A quick check now of trending stories around health and wellness from India and outside. Let's tell you about Ozempic first. Ozempic used to treat type 2 diabetes and obesity could also be used to treat a wide range of illnesses linked to arthritis, Alzheimer's and even cancer. It also has improved heart failure symptoms and cut levels of inflammation in the body regardless of whether or not people lost weight. It even helps in slowing down the process of aging. People consuming 2.4 mg dose of the semaglutide drug, commonly known as Ozempic as we know it, had 33% lower chance of dying from the sickness related to COVID-19 virus.
Whoever developed COVID and received Ozempic, the chance of cardiac disease mortality actually all decreased. So this again is a corollary to what we were discussing just now. So overall it's a medication which improves our cardiac health. It has multiple metabolic benefits including glycemic control and reduction in weight, and that not only might translate to COVID related mortality reduction, but in any disease which can have a negative impact on cardiac health, Ozempic will be beneficial.
Are taller people more prone to cancer? Well, it is a claim that is difficult to digest, but there is a study done by the World Cancer Research Fund suggesting that there's strong evidence that taller people can develop cancer of the pancreas, large bowel, uterus, ovary, prostate, kidney, skin, breast, pre- and post-menopausal. The study has found that for the 15 out of the 17 cancer patients examined, taller people had a higher likelihood of developing them, and each 10 centimeter increase in height raises the cancer risk by about 16%. Higher IGF-1 level or more cells could contribute to the increased cancer risk in taller individuals.
The taller the person is, the more cells they will have. And it's been shown that taller people have at least 1 trillion more cells, and especially the stem cells as well. So the more the number of cells, the more chances that patients might develop mutations which can lead to development of cancer. Another factor which I would say contributes is the hormones, especially the IGF-1, which is an important hormone in the development and growth of a person when he's young. And it's been shown that patients who've got a bigger height, they normally have higher IGF-1 levels, and this could be a contributing factor to the development of cancer.
New blood test detects brain cancer in under 60 minutes. Researchers have created a device that can diagnose glioblastoma, a highly aggressive and currently incurable brain cancer, in under an hour. The key part of this fast diagnostic tool is a biochip that uses special technology to find certain biomarkers like active epidermal growth factor receptors. Each test requires just 100 microliters of blood and costs less than 168 rupees. Researchers believe this technology can be adapted for detecting biomarkers in other diseases, including pancreatic cancer, cardiovascular disease, dementia, and epilepsy.
It'll be too early to say whether we'll be able to cure this deadly cancer called glioblastoma multiforme. This test, if it is validated and useful in terms of availability, then possibly we can find the patients at an earlier phase when they are a bit more robust in terms of their fitness level, which means we will be able to offer them surgical resection of their brain cancer, and then this could be followed up by giving them chemo and radiotherapy combination and then chemotherapy to increase their longevity of life.
Well, this is an extraordinary case of insomnia. A man in Japan sleeps for just about 30 minutes a day. He's been doing this for about 10 years or so. Now, on an average, the human body, as we know, requires 6 to 8 hours of sleep for optimal health. But what if we told you that a man who slept for 30 minutes a day for the past 12 years? Well, it sounds unbelievable, doesn't it? But it's true. He's maintained a sleep routine of just 30 minutes a day for 12 years to double, he says, his lifespan. He's trained his body and brain to function normally with minimal sleep and says this practice has significantly improved his work efficiency. Doctors clearly don't recommend it.
Any individual who is chronically sleep deprived in most normal cases would struggle with cognitive functions because the body is then not functioning optimally. And it is possible that a person is living and surviving like this, but the body can be in chronic stress, which can start reflecting in their day-to-day activities. It can start reflecting in how they are carrying on their decision making, their executive functioning, their memory can be affected, their mood and the ability to react to situations can also be affected by this, and hence it's not an ideal way of day-to-day living.
Your drinking habits could impact offspring and grandchildren as well. But here's more reason for you to stop consuming alcohol. The consequences of alcohol consumption can go way beyond the drinker's individual health. New studies say that excessive consumption may affect generations far into the future, even before it was conceived. Paternal alcohol exposure has been shown to affect the mental health and behavior of the offspring. Children with fetal alcohol spectrum disorders experience an early onset of adult diseases, including type 2 diabetes and heart disease. Demand is soaring for twice-a-year jab to reduce bad cholesterol. Inclisiran was developed by Novartis and launched in India in January this year under the brand name Leqvio. Cardiologists are vouching for the benefits of this jab. They say it has been a useful addition to therapies. Demand surges for a twice-a-year injectable drug to reduce levels of low-density lipoprotein cholesterol, or LDLC, commonly called bad cholesterol, leading causes of heart attacks and strokes. Now, inclisiran is recommended for individuals whose cholesterol levels remain high in spite of being on statins. The cost of the drug is actually very high though, at 1.2 lakh per injection.
At present, we have so many medicines, those are oral medicines that has to be taken daily basis. So there are some patients which do not respond to this oral medicine or who do not tolerate those oral medicine in spite of giving the maximum dose. In those patients, these injectable drugs are of benefit. Although it's a costly drug, but the benefit is immense. It is seen that in 5 to 6 months, the low density lipids, the LDL, decreases by around 50%, but it cannot be given in a lady who is pregnant or breastfeeding.